Hi everyone, welcome to the Southwest Affiliate Stroke Bootcamp series. We are excited to offer this 15-week course as a way to educate stroke coordinators in key components of their role, provide tools and resources to build and maintain successful programs, and to assist in building a large network of peers. Before we get started, we would like to go over a couple housekeeping items. To avoid background noise, all lines have been placed on mute. For the question portion at the end of the presentation, you may unmute your lines by pressing *6 or typing in the Q&A section of WebEx. Please note you will only be able to claim your CE credits at the end of the 15-week series on September 27th. A copy of today's slides and handouts will be sent to you within a week of today's call, and for future webinar registrations, please visit www.heart.org/SWA quality. Today we have a great speaker who will be discussing stroke education. Candace McAlpine received her MSN from the University of Texas, El Paso in December 2014. She maintains a national certification as a board-certified nurse executive. Currently, she is the stroke program coordinator for the Comprehensive Stroke Center at Baylor University Medical Center in Dallas. She has enjoyed working with neuro-stroke patients since starting her nursing career in 2006 and is constantly looking for outreach opportunities to create public awareness surrounding stroke. And from now on, I will hand it over to you, Candace.
Thank you. Hi, everyone. I hope everything's going good. So I'm going to talk about stroke education, and stroke education really applies to everyone, so it's for everyone. I have no disclosures, no unapproved or unlabeled disclosures. So in today's series, we'll discuss identifying why stroke education is so important. We're going to describe who needs stroke education, differentiate what types of education is needed, recognize when to provide stroke education, determine where to provide stroke education, and discover how to provide stroke education on low or no budget. I know that's important to most people. So why is stroke education so important? Each year, about 795,000 people have a new or recurrent stroke. These facts come right from the American Heart Association, and it's alarming when you see the numbers in whole. To think that 610,000 are first strokes. 610,000 people a year are having their first stroke, and 185,000 are having a second or third stroke. Stroke, as we all know, is the leading cause of disability in the U.S. In 2015, stroke deaths accounted for 11.8% of total deaths worldwide, making stroke the second leading global cause of death behind heart disease. That's a huge number. We think of our little hospitals and we're all doing our part, but really we're tackling the second biggest problem in the world. Stroke ranks number 5 among all causes of death in the U.S., killing nearly 133,000 people a year. So why is education important? Because all these people are at risk. We have so many people who have this, who have risk factors, so they may have a stroke in the future, and it's our job first to understand it, and then our job to educate the other people about it. So we have to educate groups of people so we can start to decrease the stroke rate. In 2009, 34% of people were hospitalized for stroke were less than 65 years old. So now it's not just an older person disease anymore. Now it's affecting younger and younger. And that's scary because those people are going to live longer. We have better health care now, so they're going to require more tax dollars to help them survive. So to help combat, health care costs and even our tax rates, we're going to have to get better at stroke care, but also stroke prevention. U.S. currently has childhood obesity problem that leads to unhealthy lifestyle and possibly earlier onset of strokes. And so if we want to decrease the incidence of stroke, it all starts with education. And so that's why we're all here today. So who needs stroke education? Well, first, of course, as stroke coordinators, we need stroke education. We're the ones who are the front line here at the hospital. You're the expert that everyone's running to. So we have to start by educating the stroke coordinator. And then we go further out, EMS. They're the ones who are bringing strokes to the hospital. So we have to make sure they understand what a stroke is, how important it is, and that time is brain, time is brain. Then we have the ED stroke. We have the ED stroke nurses, and you have unit stroke nurses, and we need to educate them individually because they're looking at two different spectrums of the stroke process. And then, of course, we have patients and their family. For people who've had a stroke, we have to help them recover, give them the resources, make sure they know what their risk factors are, what they can do in the future. And then we have the general public, hopefully those people who are at risk or have no risk. So the ones with no risk can identify people who are having a stroke, and you want your patients who their loved one's having a stroke to know, call 911, don't let me wait and drive them there and then sit in the waiting room till someone comes to see them. EMS, EMS, EMS. So the stroke coordinator role, really stroke coordinators are passionate about helping patients get the best treatment and have a unique position in understanding the time-sensitive nature of stroke. Their roles are instrumental in correcting stroke care deficiencies and coordinating performance improvement. I like the phrase. I think it applies to everything we do. You start with, who has a better understanding of time metrics when we're looking at these things every day. We report these in monthly meetings. You talk about them, with your EMS groups. You want everyone to know how important time is when it comes to stroke. Time is brain. But if we can't, if we don't have education, we're not going to help anyone. So how do you educate a stroke coordinator? Well, you have new stroke coordinators, and they don't all come from the same place. I started in neuro. I like neuro. I stuck with neuro. But you have stroke coordinators who have an ER background. They have an ICU background. They've worked in interventional radiology. Some are just quality. Some of these haven't done any nursing care. They just work in the quality department. So giving them, finding educational outlets for each area is going to be a little different because everyone needs a different level of education, but the stroke coordinator needs to know it all. So you have to work really well with your other departments so you can help them do better and help yourself. There are different sets of knowledge, of course, and familiarity with stroke protocols. The ER nurse is going to know what happens in the ER, and we're going to give TPA within 45 minutes where, here's the process. But they don't know what happens in the ICU. They don't know what happens in interventional radiology. Nobody else knows the whole piece. It's the stroke coordinator's responsibility to know that and then be able to help find the processes within each department to make these things work. And unfortunately, in smaller primary programs, you're finding a lot of stroke coordinators who have multiple roles. They're in charge of, their cardiac program. They're in charge of the sepsis program. Some are quality in general. They're worried about their Joint Commission surveys. So it really can be time-consuming and hard to perform to be a really good stroke coordinator and find all that education and find the time to do the things you want to do when you're bogged down with more than one program. So every minute counts, and you have to be really effective and time efficient. So educating the stroke coordinator, it all starts with your desire, passion, and then you have to have perseverance to muddle your way through. It's in the beginning, it's very complicated. You're hearing everyone talk, and they're using all these new terms and lingo, and some of it you know what it means, you're on top of it, and some of it you're like, oh my gosh, did I totally miss the boat on that one? But what really helps is doing reading and finding an experienced stroke coordinator. If you can find an experienced stroke coordinator, that's your best resource. most of the stroke coordinators I know are more than willing to help another stroke coordinator. When someone asks me, I'm always happy to show someone what I do or how I do it. That's how we all learn. And no one needs to recreate the wheel. You see what other people have done, and you try to mimic, and then you tweak it to fit your needs, to fit your hospital system. But most stroke coordinators are going to be willing to help you. You can find them, you know, locally. Here in Texas, we have regional advisory councils, and we work with the EMS there, and all the stroke coordinators from the region come. So you get a chance to network and meet other people, and that's really where it starts. You start hearing ideas, and you kind of listen to what other people are doing and try and improve your process so that you're meeting the criteria that they're meeting, and you're improving what's going on. So you can always try and find a resource there. Everyone should be able to give TPA, so every hospital should have a Genentech rep, if anything. And the Genentech rep can always tell you who another stroke coordinator is. I know the one here in my region reached out to me a few months ago and just asked me for some information for another stroke coordinator, and just because she was new and she didn't know where to go. So always use all of your resources. That's definitely a resource. If you don't know who it is, you can always go down to your pharmacy. My guess is someone in your ER will probably know who the Genentech rep is. They like to come out and help you do education with your nurses, and even your residents or new doctors coming on. You can also reach out to your local American Heart, American Stroke Association representative. For us, I have Deb. She was a mentor to me when I was a new stroke coordinator, and she and her partner at that time helped me quite a bit. It was nice to be able to ask someone questions. Even though we were in the same community, we're competitors, you still talk in stroke terms and you still talk about process. Nobody wants to shut down somebody's program. Nobody wants ill will. We're all after the same goal, trying to help the patients, trying to help the community, decrease disability with stroke, make things better. So don't be afraid to ask somebody something. If they don't want to do it, they'll tell you no, but most people are going to be really receptive. And then there are always the seminars and the symposium and conferences. You meet lots of people that way, and you can meet them from other parts of the country, other parts of the world, and it's really a good gathering. You know, how we do things in Texas is probably not the same way they do things in South Carolina. But the internal processes in the hospital, they may be doing something really well, and if I don't ask about it, I'll never know. But they're going to be willing to share, and it's not bad to share then. It's easier sometimes because they're not your direct competitor. They're somewhere else, so they feel safe to give you some of that extra information. I think as far as education goes, it's always great to know your stroke medical director. They're a great resource, and they should be your biggest supporter. They usually can tell you about things you don't know. They usually know a little history. And they're, when you're looking at anatomy or you're looking at imaging or you have an interesting case, they're ready and willing to discuss those things with you. They want you to grow and develop, and they want their program to be successful too. So use them as a resource as well. They usually know the other stroke certified hospitals in your area, and they usually know the other doctors. So they can easily get you a contact for another stroke coordinator. Always, always, always. Your stroke medical director is your good friend. Use them all you can. And then, stroke education and stroke CE, sometimes they're two separate things, but they're both available. You can do 8 hours of stroke education without ever getting CEs for it. But it may even be better education sometimes. But you want to make sure you get a balance of stroke education and stroke CE. There's a lot of education that I do, and I probably never get any CE for it, but it was a good collaborative effort, and it's just more information without having gone through that process. I know Stryker did a stroke coordinator symposium once, and I went to that, and I got 8 hours of stroke education. There was no CE, but it was great education. You know, we all talked. It's similar to this, except we had to travel, and it took a whole day. This is really nice. We get to spread it out a little and absorb and keep working. So you have stroke education for certification requirements. I printed it out, or I put it up here looking at it as acute stroke ready in the green, primary stroke centers in blue, the thrombectomy capable centers in orange, the comprehensives in yellow, and then the CSC DNV in pink. They all have a little bit different requirements as far as stroke education goes. But on this one, we're looking at the stroke team education, and you can see it goes up from the acute stroke ready to 4 hours a year to 8 hours a year for everyone else. So we just need to make sure that, you know, as the stroke coordinator, we are part of the stroke team, and so we need to be getting 8 hours of 4 or 8 hours of education a year, depending what kind of center you're in. So what does the stroke coordinator need to know? Anatomy and physiology plays a big role. That helps you identify where the stroke is. Do you think it's a big stroke? Is it one of the hidden strokes, like the posterior strokes? What are the patient's symptoms? How big do you think that is? Look at how they're acting, how they're responding. The anatomy and physiology, we all know the parts of the body. When you look at the brain, it's really kind of split up in divisions that I've never even thought about. You're talking about the same parts, but there are more parts and more parts. So I would definitely study up on the anatomy and physiology. It helps a lot in understanding the strokes. Of course, the stroke scale, every stroke coordinator should know her NIH stroke scale, and you can do that free online. Everyone has to do the 6 or 7 tests that go along with it, and then renew it every year or two to keep up to date. But it's a great piece of education, and it's something all stroke coordinators can talk to, your stroke medical director can talk to, neurologists, ER docs, everyone can talk to the NIHSS because we're all using the same tool, and there's only one way to use it. So it's a good thing to know, be educated on. Your American Heart and American Stroke Association stroke guidelines. That's on their website. You go to the guideline, you can type in stroke guidelines, and it brings up this nice row of all the new stroke guidelines. They're all in order by date. Reading some of that stuff will help you see where stroke has come from and where we're going and what you kind of want to do in the future, but it also tells you where your hospital should be practicing. What's best practice? What does the research show? How do we, improve a process here so that we can meet the standard that American Heart has set? Then you have, of course, your TJC and DMV stroke metrics, whichever one you're fortunate enough to work with. You have to know their metrics because their metrics are always going to be more in-depth than the American Stroke Association's metrics. So it's all a continuous process of reading and more reading and then applying what you learn and trying to understand it. It doesn't come overnight. It takes a lot of time, but it can be done. Remember, persevere, persevere. It's good to know the medications, the common medications that are used in stroke, your antiplatelets, anticoagulants, your nimodipine, your blood pressure medicines, all those things you're going to see so that when you're looking at cases and you're reviewing what care has been given, you can see, are we doing the standard of care according to the guidelines? Are we using the most, the simplest medications? Are we using the ones that are most effective? Are we giving them on time? But you need to know the medications and how they work to reach those conclusions. Your EMS processes, of course, are going to be important. If you're, a nurse who's worked in the ICU, working with EMS is going to be something totally new. You need to understand how they work, what their standards are, what their requirements are, so that you can work with them to meet your requirements. And then, of course, hospital processes. Hospital processes, like we said before, are going to be different in the ED than they are in the ICU. So you need to learn what everyone's process is along the path from admission to discharge. So it can be done. It takes some time. Don't rush it. But these departments are going to be your friends over time. These are the people who want to improve. They just don't know how. So they're looking to you to help them meet those guidelines and metrics that you need. And then transfer processes. So the stroke coordinator needs to know how the transfer process works from another hospital. As a comprehensive center, you get a lot more transfers because you're getting a higher level patients that need a higher level of care, or they need your interventional radiology department. And understanding that process and will help you cut down time, because you're always trying to make everything go quicker. You want it to be safer, but we know, the faster you can do it, the less brain cells that die. So it's important to work with those departments too. So when do you have time to educate the stroke coordinator? It's a continuous process. Don't ever give up. You look at things at the American Heart Association, Genentech, the National Stroke Association. They do a lot of free webinars. Some of them will give CE, some don't, and a lot of them are during lunchtime. So it's a great opportunity to stop in your day, listen to a webinar, eat your lunch, and then pick right back up. You can also attend the National Stroke Conference. That's an annual thing. It's a week long. It's full of information, almost information overload, but you come away with new ideas, new thoughts, and ideas about research. It's a great place to go. You'll meet other stroke coordinators, so you'll educate yourself not only with the American Heart information, but you'll talk to other people and get ideas on things from them too. The American Association of Neuroscience Nurses also does a stroke conference every year. Again, it's a great resource. The AANN is the one who has the stroke certified nurse certification. So even just looking at their website, they have information for stroke. This month they sent out their journal to all stroke articles. It's another good resource. And then you also have your local and regional stroke or neurology conferences. I know we had one here and they called it a stroke and neurological disease conference. Some places will just call it their yearly neurology symposium, but those things will have stroke in it too. You just kind of need to look at the agenda, but they're great. It's local, so you might get some local networking in at the same time. So where are we doing the stroke education? You can do it anywhere, because a lot of it's reading. So you can pick something up and take it with you. Of course, there are the local conferences, the regional conferences, the national ones like we talked about, the ISC and the AANN. There are a lot of online WebEx. And then you can look for your neurology, neurosurgery, and EMS conferences. EMS conferences are a good way to meet your EMS leaders to help you kind of pave the way for when you're ready to start your EMS education. So how are we going to educate the stroke coordinator? Stroke nursing certification is a great start. It's something I don't have yet. I'm working on it. I should be testing in September, so I'm excited about that. But there is a lot of information, a lot of stuff I know, but there's so much more you don't know. So it just never stops. But I think the certification's a good way to go, and I think it's a way to show your expertise level. Watching webinars and conferences, sometimes you can hit the live ones, but usually they're recorded, so you can even go back and see some webinars later. even though they're not live. You may not get the chance to ask questions, but you probably go through it and won't have many questions anyway. And if you do, you have your stroke coordinator resource. So as long as you know another stroke coordinator, you have someone you can bounce questions off of, and your stroke medical director, because they like to be involved too. Always ask questions. Never stop. I take advantage of our stroke medical director. Every time he comes to the office, I have a question. I'm trying to learn something new every time. I think it's important to keep that learning going. Memberships are a great way to get some CE hours and some stroke education. I have the American Stroke Association. I have their little basic membership, professional membership, and I get offers for free stroke CEs all the time. And it's usually the little webinars. So I can listen to them now. I couldn't make that one. I can go back and get on and listen to it a few days from now. It's still great information. It still applies, but it works in my time. The AANN kind of does the same thing. You have membership there. You get the great journal. It's got all this new research and information in it. And then it, belonging to either one of those gives you a discount to go to their conferences as well. So it's a win-win. You get some CEs because you're going to need those for to recertify your nursing anyway. Get to know the players on your stroke team. Every stroke team's a little different. Some stroke teams are a nurse and a doctor and a resident and someone from the ER. Some stroke teams are much bigger. You really got to know who's on your stroke team and what their role is, because these are going to be the people who help you make your decisions, help you improve your processes. So if you understand what their role is and what your role is, it makes it a whole lot easier. And you need to know your trauma and cardiac coordinators. These people have already paved the road. Trauma started everything. If there were no trauma coordinators, there probably would have never been stroke coordinators. So get to know them. Don't recreate the wheel again. They have resources. They've probably already put in the process that's similar to what you want to do, and they're great resources that are already in your hospital. So take advantage of them. These are resources that I use frequently, and so I've kind of put the name of them and where you can find it. Of course, the American Heart American Stroke Association, this one's for their guidelines and statements page. Guidelines are great. When survey comes, people want to see your guidelines. You'll be able to tell them which ones you're using and make sure you're using the most up-to-date. Your Joint Commission for any STK, your stroke metrics or your comprehensive stroke metrics, and they update them. They don't always send out a nice little email telling you, so it's good to look at it periodically just to make sure you know what's coming in the future. Then, of course, for DNV, they have 3 different addresses there. One's for acute stroke ready, one's for primary, and one's for comprehensive. Just so you can see their metrics, because you want to know what's going to be required of me. This is a good place to see it and start. The Brain Attack Coalition, they have great information and resources. You can use them for the public, and they have some resources within their resources, so they can help you find other resources as well. But they have a lot of good information there. The National Stroke Association, they focus on educating the public, and so they have some great. If your hospital becomes a member with them, they'll send you all kinds of information. You can get some free CEs for your stroke nurses. There are benefits there, but there's stuff on their website to see. They make really nice checklists showing risk factors. It's always worth it to look at any website and see what they have to offer. You may not want it now, but at least you'll know it's there for the future. Of course, the Stroke Certified Nurses website, so you know what you would be getting into, but I think it's a great idea. It's good education. StrokeNet, NIH StrokeNet, this is similar to the National Institute of Neurological Disorders and Stroke. They both have research and things that are coming down the line. So it's always good to read here and look at it and see what's coming next. Khan Academy is a free website. You sign up with, your personal information, but they have a whole section on intracerebral hemorrhage. They're not medical, but you watch these videos, and they're really interesting. In one facility, they used this for their ER techs. It was a great source because they could see it. It's not in all the fancy terms and lingo. It explains everything really well. But it's a good education resource, even for a starting stroke coordinator. You don't understand what an intracerebral hemorrhage is, go there and watch their piece on it, and you'll start to pick it up. It's really interesting. I like the way they walk through it and they color code things. It's a good learning tool and it's free. So then we move on to educating EMS and our first responders. One of the biggest things I push with them is their stroke screening tools. Do they know what a stroke screening tool is? Most of them can't. If you ask them, do you know the FAST? They give you a blank look, and then you start to tell them, oh yeah, I know how to do that. So they don't recognize that they're using the tools that you want them to use. So encouraging them and helping them to understand that makes them feel better, but then you're talking the same language. So it's educating them so that we're all on the same page, talking the same language. Stroke severity tools is a newer thing with comprehensive centers. On our Get With the Guidelines now, they've added a page where we're now talking about what stroke severity tool was used. Did EMS know how to use it? And so we're looking at those things. What I found was stroke severity tool, no one here even knew what that was. So we kind of went out and talked to some EMS. We talked to their houses. We wanted to see, what do you know? And, are you going to use this? So this picture here is an app, and we passed it out during some EMS education and kind of filtered it through our area now. But all they do is scan that little code, and then on their phone they'll have the ability to do 4 or 5 different severity scales. So now they can tell us, yes, we have a positive stroke, but here's the severity score. Maybe in the future this will help with bypass and things, but it's educating them first. If they don't know what it is, it's never going to be useful for us in helping improve care for stroke patients. Of course, TPA, and teaching them what to watch for if they're transferring a patient who had TPA. Did we get that normal saline started? We're talking to them and letting them know not every patient's eligible for TPA, but these are things they don't always understand when they're new, and they may not understand it when they've been there a while. They need that education to understand what you can offer the patient so they're not disappointed if they don't see you not doing something. Come back to me, the same kind of thing. Need to explain to them, not every patient's eligible for that, but if you use your severity tool, you can kind of gauge it and then help them make those decisions along the way. Pre-hospital notification, we always want them to call and let us know we're bringing a stroke in so everyone's ready. You can be at the door ready to take that patient and get them care quick. EMS responds to that. They notice those things. They like to be involved. And frequently they just want to know the outcomes because they've spent that time and they've seen your passion for it. All certifications, no matter which one you have, a stroke ready, all the way to comprehensive, everyone is required to do some EMS education. I think the perfect timing right now is with the stroke severity tools, starting to get them to recognize those large vessel occlusions. It's important that we try and educate them to get a last known well time. What medications were the patient taking so that we know, are they eligible for TPA? Can we even do thrombectomy on this patient? And then, of course, a phone number, because some of these patients are going to be aphasic. So we need to be able to have these things from EMS as well. Usually you may not get all that in your pre-hospital notification, but it's great if they can give it to you when they get there. Every bit helps. So when are you going to do EMS education? We like to do lunches here. We will do, EMS week. We stood out there with different departments. Trauma did one, cardiac did one, stroke did one. And we stand out there and we do stroke education with them every day. So this year they all got the copy of the stroke severity scale thing so they could download it on their phone. We go through this with them, but it's quick for them and it's easy, and they'll listen to you for 5 minutes so they can get their free lunch and go on their way. So do whatever you can do to help EMS help you. They also like to get feedback at our facility. So when they come in, we like to have things posted so they can see what our times are for TPA right now. How are we doing with our thrombectomies? Oh, here's a review of a case. Of course, everything's de-identified, but it's good information for them, and pictures speak volumes. So we print up these little case reviews, and we post them in the EMS break room. We make them available to them. We email them to their firehouses so that they can see what they've done, and then they're going to try a little harder for you next time. They want good things for the patients too. Local events, oftentimes if you see big health fairs, they'll have one of the helicopters out there to show off, or the newest fire truck in the city to show off what they do. That's a good time to go over and casually talk to them and figure out when a better time for stroke education could be. We do stroke education in our EMS break room. We stand out in the EMS bay. Sometimes we go to the firehouses. The only thing is when you go to the firehouses, talk to them first, see if it's okay if you go, because you really don't want to get in their way or cause any problems. So with them, we talk through email, follow-up posters like the case review, follow-up letters for TPA patients. A letter's easier because there are no real good pictures for a TPA. And this gives you the opportunity to show them where they can improve and what they've done really well. Bulletin boards, and then we have a binder in the EMS break room that has copies of the case reviews in it as well. And some of them like it. They like to thumb through it when they're sitting there eating lunch. The next thing for your stroke education, for your certification requirements, so we talked about education to EMS. The next thing would be part of your stroke nurse education. So the ED nurse, she needs education. And of course, her education is going to be different than your ICU nurse education. In the ED, you want to make sure you're educating them on TPA training. Again, your Genentech rep is a great resource. TPA training doesn't take a lot of time, but you should walk through it a couple times. You need to see it a couple times to be really good at it. Time metrics, you want to go over with them, your door to needle, your door to CT, your door to doctor. They should know these down in the ER so that they can, if they know, they can help the process to get there. If they don't know what the metrics are, they're never going to make it. Guideline updates. No need to wait on a creatinine now to get a CTA. That was the newest thing. So we had to make sure the ER knew that. The nurses down there, we don't want them to say, hey, wait, stop, hold the line. Now we don't need that. Let's just get it done. Stroke severity scales. They need to know the severity scales as well as EMS so that when the EMS is telling them, they know what they're watching for. So you're going to do double education sometimes. Thrombectomy training. It'd be nice if all the ER nurses could see a thrombectomy. I know they can't. But educating them on what it is and what the process is so they know why they're in a hurry to get that patient there. Hemorrhagic stroke care. This frequently goes by the wayside. Everyone knows, we can do all this great stuff for ischemic strokes. There isn't a lot we can do for a hemorrhagic stroke, but their care is just as important. So we want them to follow the same time metrics. If they need a stent or coiling or whatever they need, we need to get them there fast. Dysphagia screening is a big one in the ER. You probably teach on that forever. Making sure every patient gets the dysphagia, every stroke patient gets a dysphagia screen. They know how to do it. They make it fast. And then kudos notes. You always want to send them notes letting them know what they're doing well so that they keep performing to that level in the future. So when do you teach them? You can get in with their monthly meetings. Going down there at lunchtime is great. We like to do the pop in with a treat cart and kind of ask questions. So you do random questions and then have cookies or candy or fruit and offer them a treat if they get the right answer. But it's you know, it sounds silly, but it's a break from what they're doing for a minute and a little stroke education for me. EMS week, you always have time when you're down there for EMS week. Nurse stroke symposium. ER nurses have their own symposiums. You could always go there. But some of them will go to your stroke symposium because they need hours too. So you can educate them in break rooms, bulletin boards. They like to see the case reviews too. When you do them with them, you make sure you get their name on it because they're all looking to try and measure up against one another. They have online learning modules as well. Sending them emails, sometimes it works. Some people like their email, some don't read it at all. It's really trial and error. The posters again, monthly data reports showing them how they're doing so they know what they need to improve. Working with their unit educator and having vendors do CE breakfast or lunch. Then we start to look about, so there's your ED staff education, 2 hours every year. Then we move to the inpatient stroke nurse. So of course she's going to need to know how to take care of the patient after TPA. She needs to know the NeuroCheck vital sign parameters, make sure they're documenting risk of bleeding, they know what to do about Foley care. I hear some are afraid to put one in after TPA. You know, you have to do what your facility says, but you need to know the answers for the nurses. Nursing care post-thrombectomy, you need to educate on groin and pulse checks. What are you looking for? What's abnormal? When should you call someone? Hemorrhagic stroke care and the needs based on the location of the bleed. Nursing needs to understand, you know, if the patient's doing this, they may have had a stroke in this part of the brain. And that's where your anatomy and physiology comes in. You need to know what is a worsening symptom, what's a new symptom, and where's it coming from. Is it associated to what's already there? This is a progressing stroke, or is this something new? Then you're looking at, of course, they need dysphagia screen education, and they need to know about their metric data. Their VTE prophylaxis, are they getting the antithrombotic in time? And they like kudos notes as well. Up here, I started the high five board, and so when they do something really great that stands out, they get their name on it, and we put it on the board. An email goes out with a little logo. Everyone seems to like that. It's a little acknowledgement without having to do a whole lot of work. Nurse stroke education, of course, can be done at monthly meetings. Breakfast time seems to work best. You catch the night shift because they don't want to come in early before work, but they'll stay a little after if you do something early. Pop in again with the treat cart. Stroke Awareness Month is always a good time to do some education. You can do a nurse stroke symposium within your hospital and offer them education. That's a good time to give them your hospital-specific information, and of course orientation. Put things in their break room, on the bulletin boards, in the bathrooms. You can give them the online learning modules. Every hospital has those. And then of course you can talk to them through email, make sure they know what the monthly reports look like for your data metrics. Work with your unit educator, and again, help talk to your vendors and get help to do CE breakfast or lunch. Those are always good options. And depending where you're working, the stroke nurse education, as you can see, acute stroke ready and PSC don't have a requirement, but the other three do, of 8 hours. So stroke nursing, you need to be able to educate the people that are doing the work every day. Then you have your patient and family members. Frequently, this education takes a little longer. You have your risk factors and risk reduction. You always want them to know what they can do to improve their chances of not having a stroke. They need to know the signs and symptoms and to call 911. The importance of taking their medications and following up at discharge, because their needs may change over time and someone needs to be following up with them. Support groups, that's so important for the patient and the family member. They don't always know where to turn, and a lot of times they don't really need anything, they just need someone to listen. So the support groups are a great opportunity for them to ask questions and just get information without being required to fulfill any kind of commitment. It's just nice. The resources, we need to make sure that they get respite care information on adult daycare, and information to the American Heart, American Stroke website so that they have a resource, something they can look to if they need help. Patient, family member, when can you do that? You can do it in an inpatient support group, an outpatient support group, when a family member's in the room. Nurses frequently do it when they're giving their medications. They educate the families and the patient what's going on. So it really happens everywhere. The family waiting room, you leave pamphlets, your conference room for any kind of support group, patient room when you're taking care. And then you can do pamphlets, direct education, bulletin boards on your stroke unit are helpful. Books, this is a nice book here, Living with Stroke. It kind of gives them what they can look in the future, what they can predict will happen, resources. It's got a lot of information that's at a patient level. Signs and symptoms of stroke, of course, we all want them to know that. The 911 activation, personal risk reduction. So this is a picture of the risk factors, and it categorizes them into high, caution, and low risk. Doing these and like a screening down in your lobby or at a health fair, it gives them a lot of information, and it's something they can take home and see where they fall so that they know what they need to improve on. We also always ask them to share it with their providers and make sure that they have a PCP, that they need to be looking at these things so they don't have a stroke. Good time to do that's always Stroke Awareness Month. And at weekends you can head up your local churches, any marathons, or wherever there are going to be a crowd of people. That's where you really want to go to do your stroke education. But again, it can be right there at your hospital site down in the lobby. Health fairs, public events, run walks, senior centers. Seniors are going to have strokes. At least they can recognize it in one another and get help. You'd want to try and do screenings when you can so people have exact numbers, provide direct education. Everyone will come to your table if you have some kind of freebie, no matter what it is. And you want to make sure that they have their risk reduction information. So stroke education exceptions. The Joint Commission, CSC, requires their NPs and or PAs to give 2 hours of stroke education every year. This could be a lunch and learn, and it usually goes well because the NP or PA is usually working with the nurses on the unit, so it's a great place for them to just give them a little more information. They feel comfortable with them. They may ask them questions they wouldn't ask you. The DNV CSC requires nursing staff CE to be given once a year, so they have to do a stroke symposium. So those are little exceptions to the stroke coordinator role for education. So in summary, you want to make friends with another stroke coordinator. That's always a must. Make friends with the educators in your facility so that they can help you get your information to the people who need it. Read everything and listen to everything that pertains to stroke. You may not agree with it, you may not like it, but it's always good to hear something and get a new perspective or learn something new. Make every interaction a stroke learning opportunity for people you come in contact with while you're at the hospital, whether it's the ER nurse and you ask her, do you know what your TPA times are down there? Just make every interaction an opportunity. Use all your resources and never give up. Never, never give up. It's going to take a whole bunch of people for us to make this move any further and get our public, healthier and away from stroke risk. That's all I have.
Great. Well, thank you for presenting, Candace. We now want to open the floor to questions. You can press *6 to unmute your lines or type in the Q&A section of WebEx. So, Candace, we did have a question pop up. What certification do you recommend for stroke coordinators?
I think that the stroke certified RN through the ABNM is a really good thing to have. I know I was asked to help with a job description change for stroke coordinators, and that was one of the things. Even though I didn't have mine, I said I think this is important to have.
Again, you can press *6 to unmute your lines or type in the Q&A section of WebEx.
I have a question.
Yeah, go ahead.
When your medical director is not a neurologist, like for instance mine is ED, how do you elicit a greater level of engagement with them? What things do you do to kind of foster your support from the medical director standpoint?
I think when you're working with a medical director, you need to find out, okay, so is he going to be part of your ER department? Is that your medical director?
Yes.
Then you need to engage him with the metrics and show him what they're doing and, compare it. Say, here's the national standard, here's where we are, and how can we improve this? Because they're dependent on it, too. They're responsible for that program, and they want to be successful.
Okay. So do you all use, like, provider scorecards or some sort?
I do with my neurologists. I haven't done that with my ER docs because I have too many of them. But it's not a bad idea. If you had a smaller facility, it would be interesting to show them what their individual door-to-needles are. That's what we do with the neurologists here. I send them out a scorecard every month, and so they can, and I send it to all of them so they all see who's the top dog for the month and who's on the bottom, and they get kind of competitive about it.
That's a good idea. Thank you.
Yeah.
Okay, another question. In your experience, what has been the most successful method for educating nursing staff?
I think first you have to get to know the nursing staff or they're not going to be receptive to you. You're just another roadblock. So starting out with the high fives, when I came here, that's what I did. I started out with the high fives, and then they were, oh, well, she's telling me good things. So then when you come with the bad things, it's a little easier to swallow. But monthly meetings, every unit everywhere I've worked has done a huddle in the morning where the nurses get together for 15 minutes. If you see a trend on a unit, that's a great place to nip it. Add that to their whatever they read off every day, or go yourself and say it. But it gives them a little more emphasis on what you need done. Working with their educators is going to be the key, though, because they're the ones who are going to make sure they've been educated, what education they get, and that they hit their hours.
All right, so if there are no more questions, we would like to thank Candace one last time for presenting over stroke education. A couple reminders before signing off. Please note you will only be able to claim your CE credits at the end of the 15-week series on September 27th. And a copy of today's slides and any handouts will be sent to you within a week of today's call. Again, thank you, Candace, and everyone for signing on, and we'll see you next week.
Thanks. Bye.
Okay.